It's Woman to Woman Wednesday. October is Breast Cancer Awareness Month. In 2024, more than 360,000 people will be diagnosed with breast cancer. And according to the National Breast Cancer Foundation, there is hope. Advancement in early detection continues to increase the chances of survival. I am joined by our lovely panel, Renee, Cheval, Arlene, and a special guest today, Dr. Katrisa McWhite, breast surgeon and surgical oncologist at Middlesex Health. Doctor, great to have you at the table again.
Thanks for having me back. I appreciate it.
This is an important month to, I think, remind so many about screenings and early detection. What are the current recommendations?
So for women who are at average risk, the current recommendation is to begin undergoing yearly mammography at age 40. Okay. For women who are over 75, you may have a conversation with your primary care doctor to determine if you still need to have yearly mammography. For women who are at high risk, either based on previous biopsies, family history, etc., then imaging might start as early as 25, but routinely would start no later than age 30.
Wow, we hear so much about screening. What can we do on a day-to-day basis to lower the risk?
So there are many risk factors that we can't impact. We can't change being a woman. We can't change our age. We can't change our family history. But you can decide how active you want to be physically. You can decide what kinds of food choices you make so that you can maintain a healthy weight. To some degree, you can decide if you are going to have children or not, or if you're going to breastfeed or not.
What should women consider when making the decision between a lumpectomy and a mastectomy?
So a lot of it has to do with what treatments you're willing to undergo after surgery. For most women who undergo a lumpectomy, if it is a cancer that's bigger than 3 or 4 millimeters in size, they're going to be offered radiation therapy. And for some, they prefer not to go through that type of treatment. It is very well tolerated for those who need it, but some prefer to avoid it. Not every patient who undergoes mastectomy can avoid the radiation therapy, but many can.
Thank you. So considering all the factors, you know, we get checked. We do the screening every year, which is recommended, but there's some cases that requires a little more. For example, we know that dense breast, you know, it's different letters or different stages like A, B, and C, and D. So I understand that it requires an ultrasound. It's also suggested, or it's actually better to have. Do we do that all the time, or when do you suggest shouldn't happen?
So when a woman has her first mammogram, at least here in Connecticut, on that report, it will describe how dense the breast tissue is. Is the tissue firmer and a little more difficult to see through with the mammogram than a fatty breast or an older woman's breast, or is it somewhere in between? So women who have dense breast tissue are offered ultrasound here in Connecticut. It's not the same in every state. I wish it were, because ultrasound is a wonderful added imaging technique. It's different from mammography, and it allows us to capture things that the mammogram just won't show because the tissue is so dense.
Some really good information.
Yeah.
Dr. McWhite, thank you so much for coming and speaking with us today. We appreciate it. And of course, join us next week for an all-new Woman to Woman.